Larry and his wife Joanne had arrived at the hospital for Larry's 10-year follow-up colonoscopy. The procedure went well, but during their paperwork at the office, Larry began to experience a sudden urge to go to the bathroom. He passed streaks of blood, which is a common occurrence after a colonoscopy. After 15 minutes, he went again, and this time there was a lot more blood. Larry and Joanne decided to drive to a hospital nearby, and Larry informed his physician's office while they were on their way. Once they arrived, Larry was quickly taken to a room where a nurse did the usual check-in tasks, connected him to a monitor tracking his heart rate and blood pressure, put an IV in his arm, and drew blood for testing. The doctor, Dr. Woods, who attended to Larry, was sarcastic and uninterested in Larry's concerns. Larry continued to pass large amounts of blood every 20-30 minutes. The hospitalist on duty arrived and gave orders for blood and platelet transfusions, started IV fluids, and admitted Larry to a medical unit upstairs. Since Larry was still bleeding, the hospitalist ordered a repeat colonoscopy to be done the next day if the bleeding persisted. Hours passed, and Larry continued to lose blood, but it was not being measured. As his condition deteriorated, Larry buzzed the nurse's station and asked to have Dr. Woods come back. When he arrived, Larry went through his list of concerns, but Dr. Woods brushed them off and said he was overreacting. Larry's condition continued to worsen, and he was losing track of time. Eventually, he lost consciousness, but a team of nurses arrived and quickly took control. They called Dr. James, the on-call GI specialist, who told Larry that they needed to do the colonoscopy immediately. Within an hour, Dr. James arrived, and Larry was wheeled down to the endoscopy suite. He used 4 titanium clips to clamp an artery bleeding from the site of where the large polyp had been removed. Lab testing confirmed that Larry had lost nearly 50% of his blood volume. Although he was discharged the next day, his condition had worsened. The shock and blood loss had damaged his heart, kidneys, and affected his thinking and memory. Larry was diagnosed with congestive heart failure, stage 3 kidney failure, and chronic anemia. Despite adjusting his medications, he was unable to handle the rigorous requirements of practicing medicine and his daily life, and he was advised by his PCP to stop working and pursue disability. Larry's experience is a common one, and he shared some advice for those who may find themselves in similar situations. He advises patients to resist yelling at the nurse or physician, get the unit's charge nurse or manager involved early in the conflict since any delay may be a life or death issue. If the situation is serious, patients should consider pushing for a transfer to a larger hospital and, if necessary, contact the hospital's quality, risk management, or medical director's office. Improving communication with your provider may be aided by bringing another person with you to your appointment and having them serve as an advocate. Patients should prepare for their visits by reading about their problems and keeping a list of their concerns, but keeping it focused. Patients should also view their first couple of visits with a new practice as an interview and move on if it's not a fit. Larry's experience highlights the challenges patients face with the healthcare system, but by taking proactive steps and advocating for themselves, they can navigate it successfully.
Be a strong advocate for yourself always when seeking healthcare. Thank you for watching. Please like and subscribe to help us reach many people.